All right. Thanks, Jacob. So as Jacob said, myself and Michelle are from Gallagher. Essentially, the easiest way for us to explain this as your broker partner is we're kind of like your lawyer between you all and the insurance carriers. So our job is to break down the different plans and contribution models and whatnot to figure out the best strategies to try to help support all of you employees. So we appreciate you welcoming us on this call here and joining just to learn a bit about the benefits that are offered to you through the Urban League of Rochester. Um, shouldn't be too many surprises today. Things are pretty similar to last year, but we just wanted to make sure that we took some time to walk through the benefit guide with you. So that's kind of what I'll be doing here today. And then when we get towards the end of the call, I'll kick it back to Jacob just so he can go through Paylocity and kind of how you enroll online. But Jacob, correct me if I'm wrong, that should be pretty similar to last year as well.
Yes, exactly same format. It's pretty user friendly, but I'll talk through it again.
Okay. All right. Let me know when you can see my screen here. Oh, I think Jacob, are you the host for the meeting?
I think Dr. Hawkins is.
Was it? Okay. It is disabling me from sharing my screen. I don't
Yo, I'm
know.
fixing it. Hold on a second, Rock. I got you.
Okay. Appreciate it.
No worries. Sorry about that. Good afternoon or good morning, everyone.
Good morning.
You should be all set now.
Okay. All right. Can everyone see my screen there?
Yes.
Okay, great. All right. So jumping into our discussion here today, again, just want to go over a couple of basics to get started. As everyone, I'm sure everyone is aware here, this is your open enrollment is your chance to elect your benefits that are offered to you. The benefit window will be running from tomorrow, the 19th, through the 24th. So you will have about a week to make those elections. Obviously, as you're going through there, if you have questions, please reach out to us. But this is your time to go in there. Make sure you update any sort of dependents or adds or changes that you need to make within your benefits. Even if you think that you are going to be enrolling in the same plan, please take the time to go in there and review the benefits and just ensure that you have enrolled in the correct plans that you're choosing. Outside of this open enrollment window is you would have to have a qualifying event. So that would be, say you got married or perhaps you had a child. If you're in any of those situations, please reach out to Jacob or connect with myself or Michelle directly. We will be there to help guide you through that process and make sure that you do have your insurance coverage. As far as the terms to know, again, very basic. I'm sure everybody is aware of what these mean here, but we just want to make everyone understand the differences with the copay plans. Then you have your deductible plans, out-of-pocket maximums, obviously very important to pay attention to when selecting a plan. And then, for your networks, please make sure that you do find providers that are in network. If you have any issues with that, please make sure that you reach out to myself, Jacob, or Michelle as well. We will be happy to help you out. Obviously, good news, we're remaining with Excelis, so the network is as good as it can be in our area, and there shouldn't be too much trouble with that. But perhaps with vision or dental, any other plans that you might have difficulties with, please let us know so we can assist you. telemedicine, you see at the bottom there, just wanted to touch base on that quickly. This is, I feel, underutilized. I definitely think that folks should take advantage of it if you haven't done so before. Obviously, this can help save you some time and money as well, not having to go into the actual primary care physician. So again, if you have a serious injury, don't use the telemedicine. But if it is something just like a common cold, or perhaps you have a rash, that can be taken care of rather quickly and easily. And so when you do get your subscriber ID card, you will see a number right on the back actually for the telemedicine. And you will give them a call. They will get you connected to a professional, and it'll be taken care of very quick and easy. And it costs about half of what your standard primary care visit would. As I'm going through all this, feel free to stop me if there's any questions at all. Jacob, Dr. Hawkins, if you guys see anything in the chat, let me know, please. All right. In terms of the medical plan offerings this year, you will see they are the same as last year. You have your Bronze 4 plan, which is the high deductible plan. You have a Silver 17, also a high deductible plan, but you'll see the differences there. Obviously, the deductible being a bit less than the Bronze 4. And once you have met the deductible, you would be responsible for a 20% co-insurance. In terms of the other two plans, we have the Gold 5 and the Platinum 2. These, as far as the benefits are concerned, did not change. However, Excelis did sunset the Platinum 3 and the Gold 1. So just so everyone's aware, the Gold 1 is now listed as the Gold 5, and the Platinum 3 is now listed as the Platinum 2. So in case anyone does get confused, if you were in the Gold 1 last year, it's now the Gold 5. If you were in the Platinum 3 last year, it is now the Platinum 2. Again, please don't hesitate to reach out to us if you have questions surrounding this. But both of these plans are true copay plans. And as you see there on the screen, you would be responsible for those amounts upon visiting primary care, specialty visits, or if you do have urgent care or emergency room visits. All right. In terms of the medical costs this year, so I just want to address kind of health insurance, the state of healthcare in general. I'm sure many of you are aware. Unfortunately, right now within our society in general, inflation is just going up and up all over the place, and medical costs are continuing to rise with that. So unfortunately, in just alone in our area here within the Rochester market, we were seeing about a 20% renewal increase across the board, really for all of the community rated clients that I work with here. And so it's been tough to be able to strategize and combat these prices. So I just want to let everyone know and kind of give kudos to the Urban League of Rochester and Dr. Hawkins and their executive team there for trying to absorb the majority of the increases there. So in the years past, I know they were absorbing the full cost for the bronze plan there. This year, unfortunately, there was a little bit of cost put back on the employee there. So you will see that change there. And you will also see within the other plans that the prices did increase a bit. But again, I want to let everyone know that Urban League, from a benchmarking standpoint, is still doing a great job. They are above average. And I say that full transparency with other clients I work with. Unfortunately, some of these other small businesses are pushed to put some cost back on the employees. And again, Dr. Hawkins and her team did a great job of limiting the amount of cost that would be put back on the employees. Any questions at all as I go through this? Again, if it's for kind of a broad question, feel free to ask it now. If it's a one-on-one question, I will stick around to answer those questions later on. Okay. All right, the FSA accounts, something that we just wanted to highlight. This can help save you some money that you can set aside and pay for healthcare expenses. This is an account that you will put in pre-tax dollars, and you will be able to utilize it on medical, dental, and vision expenses. If you do have an HSA set up, that would be done through the bank of your own choice there. I would recommend contributing to that, because if you are on a high deductible plan, because that does roll over. I do want to clarify that the FSA does not roll over, so it is more of a use it or lose it. Again, if you enroll in this is through Lifetime Benefit Solutions. We would send over an FSA card to you, and that's how you would be able to pay for some of those medical expenses that you do incur. All right, moving on to the dental coverage. This is looking very similar to last year. This is still administered by Emeritus. You have the annual deductible of the $50 for an individual, $150 for a family, the annual maximum of $1,500 per person. Preventative care, of course, is free of charge, covered in full. The basic services will be, you will incur a 0, 10%, or 20% after you've met the deductible, depending on the service that you're having done. For your major services, it would be a flat 50% after the deductible. And as far as the orthodontia, there is no coverage on the adult plan here. As far as the rate, you will see it did go up slightly this year, but overall not too much. You're looking at $39.47 for an employee only, and $108.29 for the employee family. All right, the vision coverage. This also very similar to last year, administered by the VSP. And you will see that it is a flat $20 copay for your annual eye exam. For all of your lenses there, also flat $20 copay. And then when you're looking at frames, be sure to take advantage of the $130 allowance that you have there. Also 20% off of the remaining balance for the featured frames. And as far as your contact lenses, you would also have up to the $130 allowance. And then if they're medically necessary, to be covered in full. As far as the rates, there should be no change there. I believe we're in a rate lock. So what you see there is what you should have paid last year. Any questions on anything that I've reviewed so far? I know I'm moving pretty quickly through all of this.
Yes, when does the FSA benefits renew?
The FSA benefits?
Yes.
So on January 1st. So if you do have any FSA dollars right now that you haven't spent, be sure to spend those before the end of the year. Was that your question?
Yes, thank you.
You're welcome.
Rob, can you go over preventative services that are covered through the medical plan?
Oh, absolutely. So the preventative services, again, your yearly physicals that you'll go to once a year. You will be able to go to, say for females to see their OBGYNs. Those are covered as well. There's a whole list actually that I will send on over to everybody. You have things such as the colon screenings also. So that's a great point that you bring up, Jacob. I do want to make sure that everyone understands, even with the high deductible plans, that these are covered in full. So there would be nothing put against your deductible for any of those preventative services. So please reach out to us directly if you do need to schedule an appointment at all and you are concerned whether this is considered a preventative visit or not, because there is an entire list of a lot of different things that can be done. And also, obviously, we can prevent any further potential, issues, medical issues, by going and making sure that we have these done on an annual basis. My apologies, it's not listed on the screen there. I thought it was, Jacob.
Oh, no worries. Thanks, Rock.
All right, in terms of the basic life and the accidental death and dismemberment insurance, this is a benefit that the Urban League of Rochester provides to you, which is a fantastic benefit. Again, from a benchmarking standpoint, this is above what we typically see. I will tell you, a lot of clients I work with will only offer up to about the first $25,000 in life insurance coverage there, whereas Urban League does offer up to 1.5 times your annual salary, or the equivalent of $160,000. This is also a guaranteed issue amount, meaning you do not have to get evidence of insurability done, which means there's no actual health screening or anything that needs to be done in order for you to be approved for that amount. Make sure when you do select your benefits that you do update your beneficiaries. Again, God forbid, in the event that you were to pass away and you have this coverage, you want to make sure that the money is put in the hands of your loved ones, and that nothing, as simple as not putting your beneficiary in there, would then void who the funds going to your family members. As far as the voluntary, you can increase on top of the $160,000 there, in increments of 10,000 all the way up to 300,000, or the lesser of 5 times the basic annual earnings. For your spouse coverage, you would be able to increase in increments of 5,000 up to $50,000, and not to exceed 50% of the employee amount. For the children, it's in increments of 2,000 up to 10,000. And then again, for the AD&D, for yourself, you can increase up to $300,000 there as well. For your spouse, also up to 50,000, and then the children also up to 10,000. Now, I will say there may be evidence of insurability that you will have to provide if you do exceed the guaranteed issue amount. So if you were enrolled in this last year, that would not be the case. If you are new to this, or perhaps you waived the coverage at one point, then they are most likely going to ask you for that evidence of insurability. And if that's the case, obviously, please reach out to us. We will get you in contact to fill out the correct paperwork or go through the health screenings necessary to be able to be approved for these life insurance amounts. Any questions from anybody there? Okay. As far as the rates, they are age banded rates, as you see on the screen here. And again, I'm not going to go ahead and read all of them off here now, but just to let everybody know, you will be receiving a copy of this benefit guide. You'll be able to pull it up right in Paylocity there. We also will go ahead and email this over to you all after as well. So you can go ahead and take a look through there to see where you would fall based off of your age. What your rates would actually be. Okay, disability insurance. The short-term disability insurance is voluntary, so you can choose to enroll in this if you would like. This is a great benefit that I feel most people should enroll in, if they're able to. The reason being, again, for the state paid leave, you're only looking at about $170 a week versus 60% of your income, up to $1,000 per week, if you were to enroll in the short-term disability insurance. And again, at the rates that they come in at, I believe it's well worth it for you all to protect yourselves to do so. And then also, because Urban League has been generous enough, as you see on the next slide, to pay for the long-term disability coverage. So you would be able to protect yourself in the short term if you so choose, and then you will definitely be covered on the long term through the Urban League of Rochester. For the long-term disability insurance, you would receive 60% of your income, up to $2,000 per month, in the event that you become disabled for over 180 days. Any questions regarding the short-term or the long-term disability insurance? You all are an easy bunch here. All right, that pretty much wraps up the benefit offerings for the year. As far as contact information, we did list all of the insurance carriers there for you to reach out to if ever need be. We have Jacob's contact information on there. And I do apologize. I should have my information listed on there as well. So I will get that added when we send this over to you all. But please don't hesitate to reach out to us. Again, following our meeting here, Jacob will have the Paylocity portal open soon for you all to enroll. And as you're going through it, again, there's no bad questions. So if you are stuck for any reason, please reach out to Jacob or reach out directly to myself, and we're happy to assist you, especially with things where you feel like you're potentially in between a couple plans. Maybe you're deciding between bronze or silver, or the gold or the platinum plans, and you're just looking for some direction. I'm happy to advise you and make some suggestions. Again, I would never push anyone or steer them into any plans. Our job is just to help support, of course. So we can take a look at your annual spend for last year and kind of try to plan accordingly for this year what makes sense for you, or perhaps you have a known surgery maybe that you have coming up. We do want to make sure that we get you in the right plan that's going to cover the majority of the cost of that. So please reach out. That is what we're here for. That's our job to help you all. So thank you all. We appreciate the time, and I want to go ahead and open it up to any questions you have. But actually, just before I do that, I will kick it to Jacob. Jacob, did you want to review anything in regards to the portal and Paylocity there?
Yeah, that would be great. So before I do that, I think I'm restricted from sharing. Let's see
Okay.
if I can. Oh, it's just one person at a time. Okay. Um, so I'm just going to share my base screen here. Okay. Does everybody see a Paylocity window coming up?
Yes.
Okay. Perfect. So I'll go over the logistics of the enrollment period. So we're looking at enrollment period this year, starting tomorrow, and you're able to access it early in the morning tomorrow on the 19th. And the window is going to go through Monday, the 24th, through midnight of the next day. So make sure that you make your elections through that open enrollment period. And definitely, if you have any questions or if you want some just one-on-one touches while you go through the open enrollment period, Rock had put the email up on the screen. You can reach me. It's urbanleaguerock@hrworks-inc.com. And I know people have private medical situations going on. I'm happy to walk you through that. Rock is happy to walk you through that for any questions. So enrollment is going to be done through the Paylocity module. And the one thing I want to bring up, so it is a passive enrollment similar to prior years. So if you don't make elections, then it's still going to. So if you're not enrolled in a plan and you choose not to go in, then you simply won't be enrolled in anything. If you do have a plan from last year, and let's say if you don't go in, then it's basically going to roll over your elections from last year. But I strongly recommend, even if you did have a plan last year, to take a look at your dependents and your beneficiaries. Always going to recommend that every open enrollment period. But outside of that, just like Rocket mentioned, yeah, the unfortunate reality is health insurance is going up and on a yearly basis. Um, Dr. Hawkins has done a lot of diligence to really try to mitigate the cost rises, but make sure that when you're picking out plans that it makes sense for you financially and that you're talking to really others in the household, and if you have spouses, maybe comparing plans and seeing what's most cost effective for you. So they got rid of my test users before I started the meeting. So I had to do some last minute scrambling with some screenshots here. But to actually get to the open enrollment period or the open enrollment section of Paylocity, so it's going to be, well, colloquially known as the hamburger icon, but really the three parallel bars at the upper left-hand corner of the screen. And so I'll take a step back. In Paylocity, when you first log in, yours will look different. This is my admin screen, but you'll see like your normal pay clock, everything. Uh, but to actually get to the benefits module, it's going to be the three parallel bars. And then you go down to benefits and you click that. And like I said, we're going off of screenshots here. To access the open enrollments, it's going to be a really pretty evident screen where it says, it'll actually say open enrollments and action required. And you can then click the start button on it. And if you're already enrolled in plans, it's going to walk you through your current coverage. And right away, it's going to ask you to enter in your dependents. And for your dependents, you're going to be entering in their demographic information, their date of birth, their social security number. And once the dependents are added, and here's the screen using some Disney characters, as you walk through each benefit offering, it's going to ask you if you want to cover at any of your dependents. So even though you enter it at the beginning, make sure to individually check which dependents you want covered under the respective plans. Because the reason why I bring that up, some people, I've seen employees, yeah, I'm going to cover my, let's say my children under my medical plan, but I'm just going to be employee only for the dental because let's say my spouse has a better plan, for example. So make sure to line up your dependents with what you're looking for. And as you go through the elections, it's going to have, it's going to show the total cost per pay period. So you'll get to really just compare based on the various plans. And you'll see, so as a general rule, the more that you pay into health insurance up front with the premiums, and the more you pay on a weekly basis, when you go to actually use your health insurance, um, then it leans more towards like, let's say if you buy the more expensive plans like the gold or the platinum, that's going to be like a copay plan. If it's like the bronze or the silver, then you're going to be, so every plan this year does have a deductible, but the bronze and the silver, it's going to be a higher deductible. So you're paying less up front, but you're going to have a higher deductible than me. So that's something to keep in mind. And like I mentioned, you are free. Definitely send an email out during the open enrollment window for the 19th to the 24th. And happy to walk you through individual one-on-one sessions. And if we need to kick it up to Rock to get and any sort of more specific financial information, we can definitely do that. So that is the format of this year's open enrollment. Naturally, want to open it up. What questions can I answer from a system perspective or really from an administrative perspective? Anybody?
We have two questions.
Yeah.
Will you be able to do your HSA contribution from here as well? So if you
That
want
is an
to increase the amount or decrease it or whatever, can you do that from here?
excellent question. I'm glad you brought that up, Dr. Lucas. So the HSA, the first thing to bring up, so Excels did change the plans, and this year the HSA is not compatible with the bronze for some reason or another, just due to the design of the plan. But there is an HSA that is available through the silver plan if you elect to do that. And any changes to your HSA elections, it's not going to be in the module this year, but please send me an email with what you're looking to increase it to. And I'll just send you a payroll deduction form, and we can easily get that updated.
So Jacob, I do just want to clarify there with the
Yeah.
bronze 4, the HSA is compatible. It is qualified.
Oh, it is.
The
Okay.
bronze 7 was the one that is not. We did not elect to offer that, knowing that we had folks that have the HSA set up. So just to clarify, don't want to alarm anyone there. The bronze 4 is still compatible with the HSAs.
Okay. Thanks, Rod. Yeah, that's wonderful news. Yeah. So bronze and silver is, my apologies, it is compatible with the HSA.
And I had another question about the 401k. How do you make your 401k election?
Yeah, good question. So those are ongoing. So the benefits this year that are in the Paylocity module, they're going to include all the insurances, but for the retirement plan, that's going to be separate through Empower. And I'm just writing down, I will send you an email separately, Dr. Lucas. And if anybody is interested in participating or changing their election, feel free to email Urban League Rock at HR Works. Pretty common question that we get. So I'll reach out to you individually on that, Dr. Lucas.
How long do you have to be employed with the Urban League in order to take advantage of the 401k?
Another good question. It's going to be 1 year.
Okay.
Yeah, and I sent out an email to everybody that's currently enrolled. It's going to be the safe harbor notice. Apologize, it went out to employee non-work emails or personal emails, but that was the emails that were listed in Empower. But so if you just received a safe harbor notice, then you know that you're eligible to enroll in the retirement plan. And just shoot me an email with the contribution percentage, and I can have Empower reach out to you, and they can set up an enrollment for you. All right. What other questions come to mind?
Are there any specific plans that will cover out of state or out of network coverage for out of state college students?
Rock, I'm gonna defer that to you.
We get this question a lot. It's kind of tough to answer without knowing, what provider the out-of-state college student might go to see. What I can tell you again, at least, is being with Excelis, outside of our area here in Rochester, them having such a great network, the Blues network in general across the country is the best that you will find. So again, when those situations arise, please give me a call. I'll help assist you in those out-of-state areas in finding a provider that will be in network for you all. And if they happen to be out of network and it's someone, like let's say it's an emergency, let us know. We'll still work with you as far as how this claim is filed and save you as much money as we possibly can. So it's kind of a situation where I don't have a direct answer for you right now, but I can tell you you're in good hands. We'll make sure that we address it properly for you. So don't stress too much about that.
Thank you.
You're welcome.
All right. What other questions? And feel free to utilize the chat as well if you'd like, or you can just shout them out. Okay. So, like I did mention, I am available, and we'll get out Rock's information as well for more plan specific questions. But Definitely keep in your minds 19th through the 24th for the open enrollment period. It's going to be in Paylocity, and yeah, we'll just take it day by day. But other than that, I hope everybody has a wonderful day, and thank you so much for your time. And for your colleagues, just an FYI, we will have this recording posted on Paylocity if you wanted to refer to something in the past. And so Brianna just messaged it's through 12/24 corrector only. So good question. Glad you asked that. It's going to be through 11/24. So yeah, make sure to get those elections in. But this recording will be available on Paylocity, and I'm also going to put on the benefits guide that Rocket went through as well on Paylocity. All right. Well, thank you everybody so much for your time, and hope you have a lovely day. Thanks again, Rock, for going through this.
Absolutely. Thank you all, and have a great day. But don't hesitate to reach out. Again, I share in understanding, the rising costs and some of the financial burdens that it can have on you. As an employee myself, paying for the healthcare, it's difficult, and sometimes you're not sure exactly which decisions to make. So please reach out if you are thinking about it and struggling in any way to make that decision. That's what we're here for. But thank you all again, and we appreciate the time.
Thank you.
Yeah, have a
Thank
good day.
Have a good day.
Take care.